I've got a wild medical story that'll blow your mind today. It's 1961 Antarctica, and suddenly you're hit with excruciating abdominal pain. Oh, and you're the only doctor for thousands of miles. This is the incredible true story of Dr. Leonid Rogozov, who performed surgery on himself to remove his own appendix. But first, let's talk about what appendicitis actually is and why it matters. So, there's Dr. Rogozov stuck in the middle of nowhere with a group of scientists, and he realizes he's got appendicitis. A massive blizzard made any rescue attempts impossible. With no other options and his condition rapidly worsening, Dr. Rogozov made a decision that would go down in medical history. He decided to operate on himself. Using a mirror and with minimal assistance from his non-medical colleagues, Dr. Rogozov cut into his own abdomen, removed his inflamed appendix and sutured himself back up. All without general anesthesia, just a local anesthetic. Talk about having nerves of steel. But get this, just 2 weeks later he was back on his feet, resuming his duties as the expedition's doctor. Now let's talk about appendicitis itself. Did you know that about 1 in 12 people will experience appendicitis in their lifetime? That's a lot of inflamed appendixes, but what causes it? Usually, it's due to an obstruction or infection that leads to inflammation and swelling of the appendix. The pain typically starts near your belly button and then migrates to the lower right side of your abdomen. And trust me, it's not the kind of pain you can just walk off. If left untreated, an inflamed appendix can rupture, spilling its contents into your abdominal cavity. This can lead to a life-threatening condition called peritonitis. That's why it's crucial to seek medical attention if you experience severe abdominal pain. The standard treatment for appendicitis is an appendectomy, surgical removal of the appendix. In some cases, antibiotics alone can be sufficient to treat the condition. However, don't try to diagnose or treat yourself. Leave that to the professionals unless you're stuck in Antarctica. Speaking of the appendix, for the longest time, we thought it was just a useless leftover from evolution. You know, like wisdom teeth or that weird ability some people have to wiggle their ears. But recent research has shown that the appendix might actually be pretty important. It turns out this tiny organ could be a safe house for beneficial gut bacteria. Think of it as a bacterial Noah's Ark. When illness flushes out the good bacteria in your gut, the appendix can help recolonize your digestive system with these helpful microbes. And the appendix has evolved independently in several different mammals throughout history. That's a pretty strong hint that it serves some kind of purpose, right? So the next time someone calls you as useless as an appendix, you can tell them that you're actually a crucial safe haven for beneficial microorganisms. We've explored Dr. Rogozov's incredible self-surgery and learned about the appendix. This small organ, once thought useless, plays a surprising role in our health. Remember, for severe abdominal pain, always seek professional medical help. If you found this fascinating, share and subscribe to my YouTube channel for more mind-blowing science. Stay healthy, stay curious, and I'll see you in the next video.